Hi Farmies, I would like to talk to you today about our first anti-hyperlipidemic medication, which is Atorvastatin. So any of the medications that end in the word statin are HMG-CoA reductase inhibitors. That is a mouthful. But what that means, I'm going to talk to you about really quickly about how the statins work. So how statins work is when you eat contains cholesterol, it goes into your bloodstream directly. So that's one way we get cholesterol. Another way we get cholesterol is that our liver synthesizes cholesterol, and that cholesterol also goes into our bloodstream. So remember, we said about 75% of it comes from what we eat, and about 25% of it comes from our own body making cholesterol. So what happens is that there is an enzyme that is required to synthesize cholesterol, and it's this HMG-CoA reductase. So what statins do is they inhibit this enzyme, big X. So they are HMG-CoA reductase inhibitors. So when you block that enzyme, I don't know if you can see that very well, but statins block this enzyme right here. So the cholesterol is not able to be synthesized in the liver. So that was like 25% of your cholesterol is going to be prevented from entering the bloodstream. And so we can see what happens when it enters the bloodstream. It kind of fills in the walls of your arteries and leads to atherosclerosis. So you can see the liver has a big part of this, this whole process. So because this medication is working in the liver, we have to do liver enzyme tests. I'm going to change the focus here and make it a little bit bigger. So we have to measure our, well, that wasn't very helpful. We have to measure our patient's liver enzymes to make sure that we aren't inhibiting their liver function too much or doing any damage to their liver. So we're going to do liver function tests. We talked in Farm 1 about all of the things that grapefruit juice does to cause problems with how things are metabolized in the liver. So this is one where we do not want any grapefruit. And also related to this medication is some myalgia, which is a fancy word for muscle pain. So you can have some muscle pain related to these statin medications. And if that were to become really serious, the most serious extreme of that myalgia is something called rhabdomyolysis. So what happens in rhabdomyolysis is that you have muscle damage, and that muscle damage, the proteins and the things that spill out of that damaged tissue go into your bloodstream. So myoglobin enters the bloodstream and goes to your kidneys, and then your kidneys end up literally black. If you look up a picture of a kidney after rhabdo, they are literally, they turn black. That they cannot process that myoglobin, and you end up having a Coca-Cola colored urine, and you're very weak because you have this weak muscle. So that's just sort of another piece of this big picture that's very extreme. It's very rare, but it is a very serious side effect potentially of statins. Very small percentage of people have that happen, but it can happen. So there you have it. Those are statins.